Assalamualaikum everyone, welcome back to this channel. This is me Alia Wahid. In this video we are going to discuss about the drugs which are treating the asthma. So in the previous lecture we have discussed a beta 2 agonist and the antimuscarinic agents which are used for the asthma. Now we are going to study next class of drug, which is the methylxanthines. Methylxanthines are also included in bronchodilating drugs, so it is going to dilate your bronchioles. But how? Actually, xanthine, they have two effects. First is the bronchodilation, and second is the anti-inflammatory. But the more dominant effect is the bronchodilating effect. So therefore, we have classified them into bronchodilating drugs. So who are methylxanthine? What are them? So actually, methylxanthines are the derivative of xanthines. Which are the drugs which are classified in it? So theophylline, aminophylline, and caffeine. Actually, theophylline and aminophylline, these are two drugs, but caffeine is not a drug. Caffeine is something which is included in your coffee and in your tea. So theophylline and aminophylline, you know that their last letters are same. Theophylline is present in the tea leaves, so you should keep in this mind that if you are drinking tea, so you are taking theophylline and you are dilating your bronchioles, because theophylline is a xanthine derivative and of xanthines, and they are bronchodilating agent as well as anti-inflammatory effects. But their anti-inflammatory effects are very short, or very uh, very short acting, so therefore they are not considered that. So let's discuss their mechanism, that how. So actually they are inhibiting the phosphodiester enzyme and also inhibiting the adenosine. So let's discuss that. So this is a cell, this is what smooth muscle of bronchiole. Okay, so ये smooth muscle है, and now what is happening here? Actually, in your smooth muscles, this cyclic AMP, whenever the cyclic AMP is increased, one thing you have to remember, that whenever the increase in the cyclic AMP, the bronchodilation will happen. And whenever there is decrease in cyclic AMP, or there is increase in AMP, only AMP, not cyclic AMP. So whenever this happens, the bronchoconstriction will happen. Okay. Now what happens, there is an enzyme present which convert cyclic AMP into simple AMP. This enzyme is called as phosphodiester enzyme PDE2. So actually, you know that cyclic AMP is produced by the second messenger system. So your methylxanthine is going to inhibit that enzyme. So now by inhibiting that enzyme, they cannot convert cyclic AMP into the AMP. Cyclic AMP will cause bronchodilation, which is our main purpose in the patient of asthma. Now, second thing, how they inhibit the adenosine. What is the adenosine? Adenosine is the endogenous protein which is present, and they are going to bind on the receptor which is present on the smooth muscles of your bronchiole. And these receptors are here. These are the adenosine A1 receptors. So adenosine will go bind with that receptors and will inhibit the adenyl cyclase. You know very well, adenyl cyclase is an enzyme which is used in the secondary messenger system, and it is going to produce a cyclic AMP. Now, if that enzyme is inhibit, it means it cannot produce a cyclic AMP. And if the cyclic AMP is not produced, it's mean there is decrease in the level of cyclic AMP. And whenever there is decrease in the cyclic AMP, it means bronchodilation and bronchoconstriction will happen. So this concept is very important, you should know. Whenever cyclic AMP increase, bronchodilation. Whenever cyclic AMP decreases, bronchoconstriction. So please keep that point in your mind. So now what is the function of your methylxanthine? Methylxanthine is inhibiting adenosine to bind with that receptor. Now adenosine cannot bind with it. Okay, there will be no inhibition of adenyl cyclase, there will be no declination in the cyclic amp, and there will be no bronchoconstriction. Now let's see how they are acting as an anti-inflammatory agent. So actually they inhibit the synthesis of inflammatory mediators, and you can say inflammatory cells like eosinophil, basophil, neutrophils, eosinophils. So all of these cells, their synthesis are blocked. If their synthesis are blocked, anti-inflammatory response will be decreased out. So let's discuss how it is happening. So here I have explained that mechanism. This is your inflammatory cell. Now what is going to happen here? Already decrease in cyclic AMP is produced. It doesn't mind that how this decreases occur, but let's assume due to any inhibition of adenyl cyclase, this decreases. Due to its decrease, transcription happens in your genes, and the increase in the inflammatory cells begin to increase up. So now how to treat it? We will give methylxanthine. Methylxanthine will going to inhibit it, and will going to inhibit the production of inflammatory cells. Now here adenosine role is important, because adenosine alpha 1 A1 receptors are also present on your inflammatory cells. So they are also responsible for causing low cyclic AMP, causing the activation of protein kinase. As a result, they are going to phosphorylate cyclic AMP response element, and this element will go and causing the production of increase in the inflamed cell. So therefore your methylxanthine is going to inhibit adenosine, and stopping it from producing the inflammatory cells. Now I have a very important note for all of you, very clear concept. There are some other adenosine receptors. So adenosine alpha 1 receptor is producing the anti-inflammatory effects, but your adenosine A2 and B2, these are the two receptors, they are increasing the cyclic AMP, and as a result they are causing bronchoconstriction or anti-inflammatory effects. So these two receptors are beneficial, uh, uh, and but the others are not. So now you have seen that these two receptors have separate mechanism, because they are doing another thing, while the alpha 1 A1 adenosine receptor is doing another thing. So these are two different things. Adenosine A1 receptor is causing you inflammation, while the two naturally established receptor of adenosine A2 and B2, they are protecting you. So this was all about the adenosine methylxanthine. Let's discuss about its kinetics or its adverse effect. So here the kinetics of methylxanthine is given. They can only be given through the oral route, cannot be given through the inhalation route. And what is their dose? So they should be given in 5 mg to 20 mg. But one thing you have to remember, they cannot be give to the patient in clinical, because they have a lot of adverse effect. We will discuss their adverse effect in detail, but in the dose you just see here, when you take a dose of 5 to 10 mg, you will take some GIT side effects. If you take the dose of methylxanthine from 10 mg to 15 mg, you will observe CVS side effects. CVS means center cardiovascular system. And if you take the dose of 15 to 20 microgram, it will cause the effects of central nervous system. So what are the adverse effects? Actually, they have very high toxicity, and they have very narrow therapeutic range, that they are causing their adverse effect within their therapeutic window. So therefore, they are not used on the clinically uses, but they can give to the patient in the combination. So actually, what are their side effects? So they are affecting the multiple organs, like they affect on your skeletal muscle, causing the vasoconstriction here. They also act on your heart, increasing the heart rate. So they are increasing the heart rate. and they are also acting on the blood vessel, causing vasodilation here. So whenever the vasodilation happens, the blood pressure decreases. Now in that state, your BP is down but your heart rate is high. So this is called as reflex tachycardia. Reflex tachycardia mean, like I am saying to you, consider a person who have a very low BP, a very low blood pressure. Now his body own has a mechanism to protect him. So his body will begins to send messages to brain, and brain will send messages to the heart to contract more, to increase its contractibility. As a result, the heart rate increases. So this will become a reflex condition in which your BP is down but your heart rate is increased, because heart has given the function to work more to increase the blood pressure. But this reflex state is very of short period, because whenever heart rate increase, there increase in the blood flow, and after some time the blood pressure will increase out. So this is called a reflex tachycardia, which can be observed in a patient who is taking methyl xanthines for a long period of time. And also they are going to affect on the kidney, increase the urination process. The effect on GIT, actually why happens, because and they cause MSS. How? Because they send message to CTZ area. What is CTZ area? We have discussed it when we have discussed the drugs which are affecting the gastrointestinal tract. We have discussed the anti-MSS happens due to some kind of irritants, irritations causing agent send signals to CTZ area. What is CTZ area? This is the chemo trigger zone, which is present in your brain, and it is present in the medulla oblongata, outside the blood brain barrier. So it takes the signals and sends signals to uh, vomiting center, and your vomiting center will activate and will cause vomiting, or vomiting is same as the emesis. So there is no difference between the emesis and vomiting. They are the forceful ejection of gastrointestinal tract out through your body. So next side effect is the CNS effects. Their beneficial effects on central nervous system is that they are increasing the stimulation of central nervous system. Like when you are upset, when you are in very confused state, they stimulate your central nervous system. But when you take methylxanthines in very high dose, like you know that tea leaves contain thiophenyline, and the coffee contain caffeine. Caffeine is also present in the tea. So when you take them in large dose, they can cause CNS effect. They can cause overstimulation of CNS effects. And whenever there is a overstimulation of CNS, means central nervous system, you will observe the confusions, you will observe the convolutions. What are the convolutions? This is a state in which there is very high contraction of your muscles. So these are some side effects, and other side effects are also occurring in the CNS. So let's discuss the indication, that what kind of indication in which you can use them. So in the acute or mild asthma, or in the COPD, obstructive pulmonary disease, you can give them. Contraindication is like you cannot give them to the heart patients, because you know, due to increase in the heart rate. So if a person who is already a heart patient, you cannot give thiophenyline or aminophenyline or caffeine to them. So therefore the doctor asked to the heart patients to take tea, but in very low amount. It should not be given to the patient who have high blood pressure, because you know, they are decreasing the blood pressure, but in result they increase the heart rate. So that can affect the patient who are suffering from the hypertension, sorry. So therefore you should not give them, but they can take only 1 cup of tea in per day. Next is the pregnancy. You should not give methylcellulose because it has various side effects, and the person will have liver diseases. So here we have covered the methylxanthine, which is the bronchodilating drug. Now we are going to start the anti-inflammatory agents which are treating the asthma. So the first anti-inflammatory drug is the glucocorticoids. So glucocorticoids is actually the class of drug. In that class, a lot of drugs are present who are belong to the glucocorticoids. So let's discuss them. So here the glucocorticoid drugs are given: fluticasone, budesonide, mometasone, and triamcinolone. So how to remember them? There is a mnemonics here: fruity, badami, momos, tri. Yani fruity, badami, they are the flavors of ice cream, and momos is a dish, and try mean three, that you need fruity badami and momos three, तीन momos and fruity badami चाहिए आपको as a order. So this is the order you give to the glucocorticoids: fruity, fluticasone, budesonide, momo, tasone, and triamcinolone. Let's discuss their kinetics and their dose. So let's discuss what is their kinetics. They are used for the inhalations. For the inhalation, methasone is a drug which is given. So these are very popular drugs. So if you remember them, so focus on them. And if you can remember the previous drugs, you can. So they cannot be given orally due to some side effects, and the drugs which are given orally, they are pyridinosol and methylpyridosol, because oral route has to pass through the liver metabolism, so therefore it is not preferable. So let's discuss about its growth. So you have to gradually increase the dose. At the initial stage you will give the half dose, or less than half dose to that patient. Then when it goes to the middle stage, then you can increase your dose and become give the patient the half of the dose. And then after, when he become as usual to it, then you will can give the full tablet to that patient. In the case of oral, so in the inhalation he will puff it and take that. So what is the mechanism of action? So it reduces the anti-inflammatory cells production by arachidonic pathway. And what is arachidonic pathway? Here I explain that lipid is going to convert into arachidonic acid. This is a type of acid on which two types of enzyme will act, and it is going to produce anti-inflammatory agents like cyclooxygenase enzyme will act on it, and it will produce prostaglandin, which are the one of the major inflammation causing agents. And if the lipooxygenase enzyme acts, it will convert into leukotrienes, which are also a very important source of inflammation. So what your glucocorticoids are doing here, your glucocorticoid will inhibiting the lipooxygenase enzyme. As a result, leukotrienes will not produce and inflammation will not happen. Next pathway of glucocorticoids is also they are stimulating the lipocortin. What is lipocortin? Actually, lipocortin is a protein which is already inhibiting that process. It don't allow lipid to convert into arachidonic acid. So therefore, glucocorticoids are increasing the synthesis of lipocortin. As a result, it is decreasing the production of inflammatory cells. Second type of mechanism is to reduce the production of inflammatory cells inside the inflammatory cell. So how it is doing here, the mechanism explains. First of all, whenever you are increasing cyclic AMP, there will be bronchodilation, and there will be increase in the decrease in the inflammatory cells production. So whenever cyclic AMP protein kinase produce glucocorticoid response elements will increases, protein will synthesize out, transcription will inhibited. As a result, anti-inflammatory cells production is decreased out. So glucocorticoids are increasing that process to decrease their production. So last important point, which is very important for the Viva, this is the histone deacetylation. What is this? First of all, you need to understand what is histone acetylation, not deacetylation. This is the acetylation. It's mean what happens to you in the acetylation, the inflammatory responses are increased. And what is the state which is the histone acetylation? So this is the your DNA. On your DNA, the histone protein is attached. If the histone protein is attached, this process is called a histone acetylation. But what is histone deacetylation? It's mean now DNA is not attached with histone protein. Histone protein is deacetylized and it is removed. So glucocorticoids perform this process. The glucocorticoid decrease, remove the histone protein, and by deacetylizing it, it is decreasing. It is actually what it is decreasing the inflammatory responses. It is what doing? It is decreasing the inflammatory responses. So this was all about the today's lecture. I hope that you will like it. If you like it, then please subscribe to my channel, like my videos, and also press the bell icon to get the notification of all the video which I uploaded. Thank you so much. Meet you soon in the next lecture. Till Allah Hafiz.